Afternoon, or should I say hello, since it's both morning and afternoon, in the areas that our esteemed discussants are today. But hello, and thank you for joining us today. Welcome back, I should say. Welcome back to the second part of this three-part webinar series that is looking at the next steps, or the next actions that we can take, particularly when we're looking at women and girls' rights agenda, as well as the overall sexual and reproductive health and rights discourse, as we examine or analyze the rescinding of the global gag rule. My name is Charmaine Picado, and I'm the Regional Sexual and Reproductive Health and Rights Program Officer with SAfAIDS. I'm going to be moderating today together with my colleague Mandisa. Mandisa, please introduce yourself.
Good afternoon, good morning, depending on where you are in the world. My name is Mandisa Zwane Machakata. I'll be co-moderating together with Charmaine. I'm sitting in the Kingdom of Eswatini. I'm the SAfAIDS country representative for the Eswatini country office. Thank you for joining us.
Thank you very much, Mandisa. I'm just going to ask our esteemed discussants to also introduce themselves by name, their countries they're coming from, as well as the organizations that they represent. And later on, Mandisa and myself will share their detailed biographies as they come in to speak. I'll start with Mrs. Masiwa. You kindly introduce yourself. Thank you.
Good afternoon. My name is ATHENA Masiwa. I'm the Executive Director for the Women's Action Group in Zimbabwe.
Thank you very much, Mrs. Masiwa, and welcome. I'll go straight to Chimwemwe. If you would like to introduce yourself, please. Thank you.
Good morning and good afternoon, everybody. My name is Chimwemwe Mlombwa. I am the founder of a social enterprise called Kwachundikwanu, and I'm also the team leader of the global movement SheDecides here in Malawi. Excited to have this important conversation with you and the rest of our panelists.
Thank you very much, Chimwemwe, and welcome. I'll go straight to Tafadzwa.
Good day, everyone. My name is Tafadzwa Madondo. I'm with Save the Children. I'm a project manager based here in Pretoria, South Africa.
Thank you very much, Tafadzwa, and welcome, Humberto.
Hello, everyone. It's so nice to be with all of you. My name is Humberto Carolo. I'm the Executive Director of White Ribbon Canada. I'm based in Toronto. And I'm also the co-chair for the Global MenEngage Alliance, and I look forward to our dialogue. Thank you so much.
Thank you very much, Humberto, and welcome. And then lastly, Tian, thank you.
Hello, everyone. My name is Tian Johnson. I'm the lead at the African Alliance and the International Civil Society Observer at the Robert Carr Fund.
Thank you very much, Tian, and welcome. Thank you very much once again to all of our esteemed discussants for introducing themselves and for joining us today. SAfAIDS has begun rolling out a series of webinars under its Her Safety, Our Responsibility initiative on women and girls' rights, which was launched alongside International Women's Day 2020 to amplify narratives around the critical intersect between women and girls' rights, as well as sexual and reproductive health and rights, climate change, poverty alleviation, and economic security, mental health, and psychosocial well-being, ending gender-based violence and violence against women and girls, amongst other topical development issues which contribute to the achievement of the Sustainable Development Goals. And of course, with the era that we're currently living in, with the advent of the COVID-19 pandemic and interlinkages thereof. Within this context, SAfAIDS is hosting a three-part webinar series on the global gag, titled Global Gag Rule Is Rescinded in 2020. So what? For the women and girls' rights agenda and sexual and reproductive health and rights. Having welcomed the rescinding of the global gag rule under the Biden-Harris administration earlier in January this year, we recognize that the cold wave that the global gag rule placed over sexual and reproductive health and rights and women and girls' rights and the rights and dignity of other populations require vigilant rollback. So the webinar series is welcoming discussants from global, regional, as well as national spaces, bringing a collective of diverse contributions to the topics above. And today we have discussants that are representing a variety or diversity of sectors, but they're all speaking to the same issue and calling us all to come and collaborate and, and look at what we can do as we move forward with the rescinding of the global gag rule. So as mentioned, we have 5 speakers that are joining us today, and myself and my colleague Mandisa are going to be moderating the discussions today. So I'll go straight to our first speaker. Our first speaker is the Executive Director of the Women's Action Group in Zimbabwe, ATHENA Masiwa. ATHENA has over 20 years of program design, development, management, monitoring, and evaluation, and organizational assessment experience in Zimbabwe. She has designed, developed, and managed complex programs on sexual gender-based violence, sexual and reproductive health and rights, and has engaged traditional leadership and communities on harmful cultural practices. She has vast experiences in these program thematic sectors: community stabilization, community engagement, civil society strengthening and mobilization, human rights, gender equality, and gender-based violence. Mrs. Masiwa has strength in advocacy as she has led sexual and reproductive health and rights related advocacy. She also has strength in coordinating programs and has contributed immensely to advocacy work on the access to safe abortion in Zimbabwe. ATHENA holds an advanced certificate in sexual and reproductive health and rights from Lund University in Sweden. She also holds a Master of Science in Development from the Women's University in Africa and a bachelor's degree in adult education from the University of Zimbabwe. Her background is generally nursing and midwifery. Mrs. Masiwa has written extensively on sexual and reproductive health and rights. She also sits on several boards and councils and currently sits on the country coordinating mechanism for the Global Fund in Zimbabwe and is the chairperson for the Women's COVID-19 response under the Women's Coalition of Zimbabwe. At regional level, she has been recognized by Gender Links for work on sexual and reproductive health and rights, and she has also been awarded by SAfAIDS for championing the gender equality agenda in Zimbabwe. She's a senior New Voices Fellow, and recently, as early 2021, she won an award under Gender Links for projects she implemented on access to safe abortion. And today she's going to be giving us insights on the webinar topic through the lens of reigniting the power of communities on reversing the global gag rule damage and what the experience of the global gag rule has taught us to do differently around women and girls' rights agenda going forward. Mrs. Masiwa, welcome to the webinar series, and please go ahead. Thank you.
Thank you very much, Charmaine. It is really an honor, and I want to thank SAfAIDS for the opportunity for me to speak at this webinar on how we are now viewing the rescinding of the global gag rule. We really had documented the impact of the global gag rule in Zimbabwe as Women's Action Group. And I want to highlight some of the impact which really was felt by everyone in Zimbabwe. Firstly, advocacy for choice was really affected by the global rule. So I'm sure you know how really excited we are now that it's been rescinded. We also noted that there was an impact on access to sexual and reproductive health rights services in Zimbabwe, because most of the organizations who were affected by this rule were working with women and disadvantaged girls at community level, and suddenly they had no services. We had organizations such as Population Services Zimbabwe, whose services were reduced by 50%. They would go out like at 100%, but they cut their services by 50%, which meant the other 50% women and girls were not getting services. We also found that this gag rule questioned or challenged organizational values and principles, because there were some organizations who then chose to really go by the rules of the global gag rule and leave the other work they were doing. And in the process, it seemed like they left all the other work around sexual and reproductive health and rights and concentrated on issues which were really not of importance to the women and girls who are disadvantaged in the communities. We also saw women not being able to access contraceptives, because this rule was not well understood in Zimbabwe. And people just thought you didn't have to talk about abortion, and that was that. So many services were really affected by this rule. And what we are seeing now is, now that it's been rescinded, women organizations are coming together, forming a strong movement which is working on access to safe abortion in Zimbabwe. Because for us in Zimbabwe, we have noted that access to safe abortion has become a class issue, where those who can afford can go to South Africa, or they can pay private doctors and be able to access safe abortion. So because of the global gag rule, this movement had really been dissipated, but now we are up again as a movement and pushing for our cause. And we are also using the justifications around the fact that it's more costly to offer post-abortion care, because for Zimbabwe, post-abortion care is offered without questions asked. But we are saying, how can a government offer post-abortion care and not offer safe abortion? Because safe abortion is cheaper. So now we are speaking freely as a movement on access to safe abortion. We also are also speaking to the fact that as women or men as well, they will be against abortion today, but when they are faced with a situation tomorrow, they will be for abortion. So for us, we are seeing the movement rebuilding, and we are also reaching out to other networks or movements such as the SheDecides movement. We are a member of that movement, and we can safely talk about abortion. We've been able to engage our members of parliament on the same, and we have been able to engage gynecologists and obstetricians. Even traditional leaders have also participated in our work. So we really welcome the rescinding of the global gag rule, and we know it will take us a long way, and women will be able to access comprehensive sexual and reproductive health rights in Zimbabwe. I will end there for now. Thank you.
Thank you very much, Mrs. Masiwa, for those brief but very comprehensive remarks, particularly as we look at how you're reigniting, the community response in Zimbabwe following the rescinding of the global gag rule. And it's so powerful that you speak about speaking freely, that now the voices have been ungagged, the advocacy can go on. And this has also strengthened the collaboration, between civil society and other partners, including key players such as the political and the traditional leaders as well, given the power and the authority and influence that they hold in Zimbabwe. And also just bringing to the fore the disruption in terms of services and how women's health and well-being was affected with these disruptions following the rescinding of following the reinstatement of the Mexico City policy, particularly looking at key service providers having to reduce their services by up to 50%. And for now, I'll hand over to Mandisa to introduce the next speaker. Thank you.
Thank you, Charmaine. Thank you very much, Mrs. Musiwa. What you speak to actually echoes the sentiments that were shared yesterday by our discussants when they said the movement needs to be energized. It's clear that in Zimbabwe, the movement has already been energized. And even as other countries, we will actually be learning from what is happening in Zimbabwe. Thank you very much for sharing that with us. I'll move on to our next speaker. Our next discussant is Humberto Carollo, who is the Executive Director of White Ribbon Canada and Global Co-Chair of the MenEngage Alliance. He is a men and masculinities and gender-based violence prevention expert with 20 years of experience in the not-for-profit sector. He has extensive cross-cultural experience in developing and overseeing large-scale multinational programs and strategies involving diverse stakeholders in numerous sectors. Currently, Humberto is focusing on developing educational strategies to engage men and boys in promoting gender equality, healthy masculinities, and preventing gender-based violence. He has developed and implemented training programs for male-dominated sectors, including sports and the military. And he has delivered high-level workplace gender equality and sexual harassment prevention training to the UN. Humberto sits on the External Advisory Council for the Canadian Armed Forces and Department of National Defense's Sexual Misconduct Response Center. He will also be speaking to us on the insights around the global gag rule through the lens of the White Ribbon Canada and MenEngage Alliance, and what the experience of the global gag rule has taught us to do differently around women and girls' rights agenda going forward. You have the floor, sir.
Thank you very much, Mandisa, and my gratitude to you and to the panelists and to SAfAIDS for putting together this important dialogue. And I'm happy to participate and bring in the perspective of the role of men and boys in supporting the rescinding of the gag rule, and more broadly supporting sexual reproductive health and rights, and how men and boys can support the women's movement towards these broader goals. So for too long, men have stood on the sidelines of the movement to end violence against women and to promote gender equality. But we're seeing changes. The tide is turning, and with the strengthening of the collective work of the women's movement, together with organizations focusing on engaging men and boys, we're making some progress, but it's slow. And with the help of the Me Too movement in North America and around the globe, and other social movements, men are beginning to embrace in greater numbers their responsibility in advocating for gender equality, sexual health and reproductive rights, healthy masculinities, and ending gender-based violence at all levels, from individual behavior change and accountability to dismantling systems of oppression and patriarchy at the highest levels, which impact on women's reproductive rights and health and choice. However, the vast majority of men, including many working in the engaging men and boys field, are still unsure and largely silent on the question of a woman's access to abortion and reproductive rights. Could abortion still be viewed by most men as a women's issue? Likely. We were able to break that barrier when it came to gender-based violence and gender equality. So why are we stuck on abortion and reproductive rights? Removing access to safe abortion is a form of gender-based violence as far as I'm concerned. We agree that other forms of dominance and control over women's lives and bodies, such as sexual, physical, financial, psychological, constitute violence, and we should speak out against it. Controlling a woman's reproductive choices, including access to abortion, is therefore a form of individual and state-sponsored dominance, control, and coercion over a woman's body. If we understand our role in speaking out against all forms of violence against women, then we should speak out against this form of violence too. So in rescinding the global gag rule, men can stand together with women's organizations in the women's movement and promote sustainable change in this area. women's access to reproductive choice and health should be a basic human rights, and it should be entrenched in state constitutions and law. And that's something that we need to continue working hard towards. And men have a role to play in that sense, in supporting, again, women's organizations and the women's movement in demanding for that view that access to safe abortions is a human right. It is a basic human right. We also know that the impact of the global gag rule has been significant in terms of other vulnerable populations, whether it be the poor, displaced, LGBTQ communities, and so men are impacted by that too. Their families, their family members, their spouses, their partners, and so forth. And they themselves are impacted by these rollbacks. Their access to information, health, contraception, protection, access to HIV supports and medications, all of that has been impacted by this gag rule. So men need to step forward and help to roll this back and help work together with organizations locally and globally to entrench these rights, because they too can benefit from it, but primarily women and vulnerable populations who have been disproportionately impacted by these rollbacks. So I call on all men and all organizations working with men and boys to stand in solidarity with this movement, to support what comes next, which is bringing back these important services, these important supports to women, to youth, to LGBTQ communities, and help to redress these inequalities. Because without doing that, without rolling back this discrimination, this violence, these inequalities, we will continue to be behind in achieving true gender equality and progress in our communities and around the globe. So thank you so much, and I look forward to hearing what my esteemed panelists have to share as well, and continuing the dialogue. Thank you.
Thank you very much for that very insightful presentation, Humberto. Yesterday, one of our speakers spoke about how men also sometimes they put pressure on women to actually access abortion services. So it is true, men have a very critical role to play in terms of the movement, not just in terms of beneficiaries of safe abortion as well, but also as partners in the development agenda. So I really appreciate your invitation to men and your call to action to say men need to partner and move forward this agenda. And when you said any form of dominance over women's bodies constitutes violence, for me it's like another light just went on in my head. Thank you for that. I think that with words like that, that will inspire other people who are sitting down and think, this is not part of my story, to realize that everybody has a role to play in terms of ending unsafe abortion, in terms of making sure that women have access to full sexual reproductive health rights. Thank you very much for that, Humberto. I'll move it over to Charmaine to introduce Chimwemwe, our next speaker.
Thank you very much, Mandisa, and thank you very much, Humberto, for explicitly stating that access to safe abortion is a basic human right. I mean, if we're talking about freedoms and liberties, we cannot leave this out. And also for the call for men and boys, as well as organizations that are working with men and boys to come together and stand in solidarity as we address restrictive access to safe abortion, and just bringing to the fore the intersections between restrictive access to safe abortion and gender inequality and discrimination. Our next speaker is Chimwemwe Mlobwa, who's the founder and executive director of Kwatu Ndikwanu. Chimwemwe is the founder of Kwatu Ndikwanu, as mentioned. She's a social enterprise, which is a social enterprise that exists to economically empower young single mothers who are survivors of gender-based violence. Chimwemwe is a communications specialist by profession and a human rights activist with a particular interest in body politics and bodily autonomy. She uses her talent and privilege to highlight and combat issues as well as the realities that young women face in rural Malawi through storytelling and art advocacy. As the movement leader of SheDecides Malawi, Chimwemwe has successfully created a space where young women and girls have a seat and are creating a new normal in Malawi. She's going to be speaking us today on the webinar topic, but through the lens of perspectives of SheDecides and her own experiences on how to reverse the global gag rule and the damage that the global gag rule brought about in the past years, and what the experience the GGR has taught us and what we can do differently around women and girls' rights, as well as sexual and reproductive health and rights agenda as we move forward. Chimwemwe, welcome, and please go ahead.
Thank you so much. I'm not sure if everybody can see my screen. I hope you can all see my screen.
Yes, we can see your screen. Please go ahead.
Okay, so I'm not sure if everybody knows about SheDecides, so I'll just take a minute to share with you what the movement is about and how we've been using art to kind of change the narrative. I'm not going to go too much into the global gag rule. I think Mrs. Masiyiwa really shared a lot, and I think our contexts are extremely similar, especially on the terms of funding, where when the global gag rule was reinstated, a lot of donors were like, no, you know, we can't fund SRHR projects. So that really did push back a lot of our efforts. But just to get into it, SheDecides is a movement fighting for bodily autonomy and focusing on the Stand Out, Speak Out pillar here in Malawi. And we're doing this by shifting norms, engaging new audiences with accessible language and content, because what we've realized is usually when it's issues of sexual reproductive health and rights, particularly to do with the global gag rule, because language is so technical, a lot of people in society feel like these issues do not affect them. So as a movement, we thought that it was really important to kind of make sure that everybody kind of understands, and we actively disrupt gender and power dynamics to work towards a world where obviously women and girls decide about their bodies, lives, and futures without question. So, oh, I don't know why my screen has just stopped, but recently in Malawi, the termination of pregnancy bill was presented, which is a bill that basically was seeking to kind of change the legislation around safe abortion here in Malawi. So obviously abortion is not illegal, but it is very restricted. And through our advocacy, we actually kind of figured out that a lot of young people are usually used as tokens or not included in the decision-making processes as well. So we thought to ourselves, how do we get actively involved and make sure that our voices are heard? So we did this by using different forms of art. In 2020, SheDecides Malawi actually developed a 10-episode video series showing the effects of the global gag rule here in Malawi on young women and girls. But now with the new administration and the current situation, I think I just have to also commend my two colleagues who were speaking before, is what we are also trying to do and what we've noticed is very necessary is a lot of support for the feminist movement, particularly the young feminist movement, because what we've noticed is that we are rarely represented in these decision-making spaces, particularly with issues to do with bodily autonomy, but we're always the first ones to be given as an example. Oh, okay, yeah, my presentation is back. So as you will see, SheDecides is centered around young women. So here we all are as leaders. We really have changed the narrative and the status quo around issues of bodily autonomy. So some of these pictures just show how we use art. So for example, you can see in the pictures where people are holding up placards. We had a silent march, which was symbolic in the sense that in Malawi, there were a lot of cases of people being stripped because of what they were wearing. But we just wanted to show that we're creating a new normal where you shouldn't be asked about what you're wearing because it's nobody's business. And if you'll see in the bottom left-hand corner, we engaged young women and girls also because some of them can't necessarily read or write, but they are able to express themselves through art. So upon explaining to them and having them understand what the global gag rule is, we were able to come up with vision boards of what world they would like to live in without the global gag rule being there. So we were also able to amplify their voices and what they want, because we always feel like there are solutions, but young women particularly are not involved at the decision-making tables or making the solutions. So these are just some of the statistics regarding abortion in Malawi. And what is funny is when the termination of pregnancy bill was presented in parliament, none of the members of parliament actually even wanted to talk about it, and it was already rejected. And what we found very, very interesting was that it was actually a lot of the male members of parliament that was standing behind this. Nobody in the Parliamentary Women's Caucus wanted to take this up, even though it was at the request of the Ministry of Health. So I think there was also kind of an opportunity for us as young feminists and as a young feminist movement to kind of take ownership of the termination of pregnancy bill and advocate effectively. So unsafe abortion is actually one of the major causes of maternal death, and complications are between 6 to 18%. Just giving you an example of also how we used art to kind of simplify what the legislature says and what the new one is presenting, so kind of everybody can understand that this is an issue that affects everybody. I like what Mrs. Masiwa said, that it is a class issue. I think they're realizing in Zimbabwe, and I think in Malawi it is the same thing, because, for example, I myself am in an urban area and I have access to financial resources. So if I want to go and access a safe abortion at a private institution, I will be able to. Whereas women in the rural areas, no matter what age they are, whether they're young or older, because of that gap within the financial resources, they would not be able to access this. So I think one of the things that we're trying to do is just make these issues of sexual reproductive health and rights, especially the global gag rule, something that an everyday person can understand and know that it affects everybody and not just us who are in this sexual reproductive health rights space. So this is how we used art to lobby the duty bearers, community leaders, and the policymakers. As I said, we had media campaigns, especially during COVID. We used old mainstream media, particularly radio, to kind of reach some of the harder to reach areas. Then we had a 10-episode video series on the effects of the global gag rule. We also created a song so that young people are also aware of how some of these issues affect them. And we had open mics and open houses with different policymakers and leaders to kind of amplify our message and make it known. So thank you very much. That's my presentation, and just sharing you how we have kind of worked around this and tried to create a new normal where young women have a seat at the table and we can decide.
Thank you very much, Chimwemwe, for sharing your presentation as well as your remarks with us, particularly looking around strengthening the young feminist movement, bringing to the fore the experiences as well as just the expertise as well of young women that are taking the lead in Malawi, as well as just using creative ways of reaching out to more young women, using arts for advocacy to reach out to communities with limited literacy. This becomes very important, because if we have a shared understanding of what exactly we are addressing, then the collaboration becomes stronger. The voices, the advocacy is amplified as we move towards ensuring that the health and the well-being of women and girls is put at the forefront and is not compromised as well. And just also just the remarkable intersectional analysis of the impact of the global gag rule on the lives and the well-being of women and girls in Malawi, bringing to the fore, as mentioned earlier by Mrs. Master, the issues of class, the issues of gender disparities, as well as some of the, the inequalities that come with geography or where we are placed and how that impacts our access to services, our access to information as well. I'll hand over back to you, Mandisa, to introduce the next speaker. Thank you.
Thank you very much, Charmaine. Thank you very much, Chimwemwe, for that very energetic voice of young women. It's always encouraging when we know that the movement is going to be safe, because younger women are already sitting at the table and they're gaining the experience and they have the passion and they're speaking on the issues that actually affect them. And when the call comes from the people who are actually affected, no one can deny it. So thank you very much for sharing what you are doing in Malawi. And I think that it's going to be good for us in other countries to also learn from the movement that's already there and what we can do differently in our own countries to strengthen and energize the movement today. Thank you very much. I'll move on to our next speaker, who is Tian Johnson. Tian is a queer African activist who is a founder and head of the African Alliance, a global nonprofit working on a range of health issues with a current focus on COVID-19 and its social impact. He's also a member of the South African Ministerial Advisory Committee on COVID-19 vaccines, an Aspen 2021 New Voices Fellow. He's also a founding member of the Vaccine Research, he's also a founding member of the Vaccine Advocacy Research Group, a global group of advocates working to ensure that vaccine research is accountable, transparent, and community-owned. Tian serves as the International Civil Society Observer of the Robert Carr Fund and GPV expert advisor to the Hands of the second program, which works to reduce violence against sex workers in South Africa, Botswana, Mozambique, Zambia, and Zimbabwe. In 2021, Tian joined the COVID-19 African Vaccine Delivery Alliance, known as AVDA, as co-chair in the Community Engagement and Risk Communication pillar. AVDA has established the mechanism for immediate shipment of vaccines to countries for rapid deployment, developed a vaccine supply chain implementation and monitoring framework to guide countries and ensure close monitoring and planning, and the implementation phases, and identified and responded to enabling factors, challenges, and lessons learned from the vaccine deployment. Tian also works with a range of donors and philanthropists to better understand their role in the decolonization of the development sector. Tian is going to speak to us on his own insights through the lens of the African Alliance within the COVID-19 context, what it actually means to reverse the damage done by the global gag rule and the cold wave for general and specific populations, and what the experience of the global gag rule has taught us to do differently around issues that affect women and girls' rights agenda. He's also going to speak to us on COVID-19 as it's now at an extra span and already complicated development agenda. You have the floor, Tian. Thank you.
Thank you so much, Mandisa. Thank you, Charmaine, and thank you to SAfAIDS and your partners for giving us the space to share some of our perspectives and views in terms of how we've experienced not only COVID-19, but within our historical context of working in the SRHR space. You know, colleagues, we applaud the strong stance, and now we urge the new Biden administration to really step up and expand abortion access. But of course, we know it goes beyond abortion. As Humberto said, there's a range of issues, and we have to really focus on how we build solidarity across causes. SRHR, in our view, is really grounded in principles of racial and social justice. We see communities across the world, communities of color and Black communities, bearing the brunt of restrictive policies, and they disproportionately suffer the consequences of these policies. So we have to look at how we strengthen solidarity and advocacy between the women's rights movement, the SRHR movement, and the LGBTQIA movement, and ensure that working together with these communities is absolutely critical in our work for health, justice, and equality. But it also speaks to the need to ensure that the legacy of the global gag rule is undone through demonstrating the impact that this harmful and racist policy has done beyond abortion. We've known for decades that key populations like queer people, like inmates, like those who use drugs, like sex workers, struggle to access basic SRHR. And this has been further impeded by the rules and the restrictions that the gag rule brought and did not go away with the withdrawal of the gag rule. That legacy will maintain and persist for many, many years to come. And of course, it is up to us as civil society to continue responding to undoing the damage that has been done. But as we continue to undo the damage that has been done, we have to remember that our mandate to undo this damage is put upon our shoulders in an environment where our funding is decreasing. Political support for SRHR is, in some cases, decreasing. We still have African governments in the main who fight back against comprehensive sexuality education and SRHR. And so there are spots of excellence, but there are also spots of rust. If you look at some of the historical baggage around the gag rule, you're looking at, for example, the International Planned Parenthood Federation with partners across the country who have had to close down offices, retrench staff, etc., etc. We've seen healthcare workers that have reported increases in teen pregnancies, unsafe abortions, STIs. So you're still seeing this persistent pushback, not only against SRHR, but also now this extra burden of what this response means in the context of COVID. Since the onset of COVID, we've seen a surge in facility-based stigma. These are facilities that we historically rely on to provide SRHR. And there's an additional wave of stigma around these facilities as the facilities have been positioned as places where people can go either to be tested for COVID or to access a vaccine or for treatment. Just in one province alone in South Africa last year, we saw nearly 600,000 people who did not access chronic medication as a result of latent fear in accessing healthcare facilities. And what that forced us to do is look at public-private partnerships that saw chronic medication packages, 600,000, being delivered to the doors of those people who were at home and who did not feel comfortable with accessing clinics. And it goes beyond accessing chronic medication. What does this mean for the inner condom? What does this mean for condoms, for reproductive supplies and commodities that communities have relied on through their clinics? So we have to look at how we are now not only having to set up to continue our work for reproductive justice, but also better navigate that quest for justice with the realities of COVID. The gag rule has been brought back. It is here, and it's here in a more powerful and impactful way than we have ever seen. And that is in the form of the recent decisions by the UK government to cut funding. 85% reduction in funding to UNFPA, an agency that provides reproductive health supplies and programs worldwide. That's 131 million pounds that would have helped UNFPA prevent 250,000 maternal and child deaths, 14.6 million unintended pregnancies, and 4.3 million unsafe abortions. So what we are seeing now, colleagues, is while the gag rule might be an immediate part of our history that we still need to work on undoing, there's a more blunt tool that has arrived. And that is directly as a result of the UK government pulling SRHR funding. And many people have actually said that these cuts present more of a danger than the global gag rule could ever have presented to us. Because of course, we saw the results of the gag rule manifesting in a range of ways, some subtle, some obvious. With the UK government funding cuts, what we've seen is a direct withdrawal of funding to those who work at the front lines of SRHR. If you take one example, MSI Reproductive Choices, what we used to call back in the day Marie Stopes, one of the largest organizations working in SRHR, looking at Ghana, Nigeria, Sierra Leone, Niger, Mali, Senegal, Burkina Faso, they rely heavily on UNFPA. But now with that support pooled, what does that mean? That means their costs go up and they have to pass on those costs. And what that means is less adolescent girls and young women, less queer people, less trans people, less sex workers, less inmates being able to access SRHR services. What is particularly problematic about this cut is that they are pulling money on agreements that have already been signed. And that is tragic and that is dangerous. And so we really, whilst we take a short, perhaps, breath after the gag rule being rescinded, we need to immediately pick up again, reorganize, remobilize, strategize, advocate, and hold those in power to account. UK government representatives in your country need to be held to account. Civil society across the world needs to show representatives of the UK government the immediate damage that their decisions to pool this funding is posing to the material work that organizations working in SRHR does. Because what this decision means is that millions of women will not have access to contraception that gives them the ability to choose when and if and how many children to have. These specific cuts actually breach a signed agreement that the UK made with international partners. So you're seeing these huge organizations across the world that are having to retrench and lay off staff, but you're also seeing the partners that they sub-granted to having to close doors and having to deprive communities further of a service that governments have a mandate to provide to their community. It's also about encouraging strongly the UK government in all of the countries where we work to walk the talk. They constantly claim that girls' empowerment is a key objective. How do you proudly say, as the UK government, that girls' empowerment is a key objective, whilst you strip the very tools, the resources, and the opportunities to realize young women's agency from their hands? I want to repeat, this withdrawal of funding will do more damage to SRHR than the global gag rule ever did. It's a material weapon. So colleagues, as we move forward, we must make sure that the discussion on the gag rule and now the UK development cut must include the voices of sex workers, those who use drugs, inmates, LGBTQI communities, to not only stand in our own spaces, but also consciously understand how do we build solidarity across causes. The gag rule is not gone and has presented itself now in a new form as an even more insidious and blunt weapon against our collective SRHR work and the dynamics that COVID-19 has brought to the fore. So we thank you for this opportunity to engage, and we look forward to engaging.
Thank you very much for that very passionate presentation, Tian. When you said we need to build solidarity across causes, you know, it spoke to the strength in numbers, how united we will actually be stronger. And your call to make sure that we don't just have women and girls sitting at the table to discuss the ending of the gag rule, but bringing up across LGBTI communities, bringing across sex workers, different groups which are actually affected by the laws that are passed, sometimes without even looking at how they are going to affect the person on the ground. And when you spoke about how organizations have had to shut down, and even now, even though the gag rule has been rescinded, getting them back and onto the ground and actually providing the services is not something that will happen within a few months. And it's not something that might even, some of them, it's not even possible for things to go back to normal. So the damage will be far reaching and far more than just ending it and saying, okay, now we can go back and do this. So it's important to make sure that we end things that cause damage permanently. And it speaks to what Sarah spoke to yesterday about making sure that we strengthen the movement and we call all partners and people and players on the table to say, how do we make sure that it is not actually brought back? How do we sign the petitions? How do we sign the letters that show that, for example, the letter that Change is sharing to say we need to sign to show that even as a woman in the Kingdom of Eswatini, I'm saying that bringing the global gag rule has an impact on my life and on the life of my daughter and on the life of my sisters in my community even as a person on the ground. So I hear your call, and I hope that even people who are following us on the live stream on Facebook or any other platform are also hearing it and will also share with different partners, because it really is a call to solidarity to say we all have a role to play, and we need to make sure that we play that role in order to make sure that access to sexual and reproductive health rights for women and girls and all affected communities, including sex workers, LGBTIQ communities, IDUs, people with disabilities, every single person, every single human being enjoys their full sexual and reproductive health rights. Thank you for that, Tian. Charmaine, you have the floor to introduce the next speaker.
Thank you very much, Mandisa, and thank you once again, Tian, for really bringing that strong call to action on how we can use the lessons that we learned from the global gag rule to immediately, re-strategize, remobilize, and come together as we address the UK aid cuts that have just, been announced and are now with us. And then just talking about re-strategizing and revitalizing, we move straight to Tafadzwa, who's going to be speaking more about revitalizing communities in line with this topic. But Tafadzwa is the Sexual and Reproductive Health and Rights Knows No Boundaries project under Save the Children Sweden. Tafadzwa Madondo has a master's in law with the specific focus on international human rights and children's rights. She also has experience in working with civil society organizations that advocate for the rights of children and youth in Africa. Tafadzwa has extensive regional, multi-country experience in project management of donor programs in East, West, and Southern Africa, focusing on comprehensive sexuality education, sexual and reproductive health and rights, HIV prevention with a human rights-based approach to programming. The key programs that Tafadzwa has managed focus mostly on children, adolescents, and young people. Tafadzwa also has experience with implementing programs in collaboration with the African Union, with the Southern African Development Community, SADC, as well as the Eastern African Community and the United Nations, particularly UNFPA, UNESCO, UN Women, the International Organization for Migration, and UNICEF. Tafadzwa is currently managing the Save the Children SRHR Knows No Boundaries project based in Pretoria, South Africa. And today she's going to be speaking through the perspectives of adolescent girls and young women, comprehensive sexuality education, and the education sector in reversing the global gag rule damage and what we need to do differently to revitalize women and girls' rights and sexual and reproductive health and rights agenda going forward. Now that the global gag rule has been lifted. Tafadzwa, thank you and welcome.
Thank you very much, Charmaine, for that introduction, and thank you to all the speakers. I think my role is now to speak to what we need to do next. I will just share my screen. I prepared a very short presentation that will kind of summarize what has been going on in the conversations that we have been having right now in this webinar. So I won't speak much to what the Gag Rule is because this has been spoken about with most of the panelists. But just one thing to note that in 2021, President Biden rescinded the policy, which meant that agencies that are involved in the foreign funding were required immediately to cease the conditions of the Mexico City policy. And I can relate to what Ms. Masiwa said, that we were very happy and we look more to seeing what's going to happen. And furthermore, these agencies were basically given condition to immediately waive the Mexico City conditions that were put in under the Trump rule. So what does that mean to us as organizations that are working in child rights and working with issues of women and children? We'll speak to the Save the Children reaction. We were deeply concerned about the Mexico City policy. Therefore, we are very happy that this has been rescinded. And we really publicly stated that this was a bad policy. And as a child rights organization, we're very much committed to helping ending the preventable deaths for children and mothers around the world. And Save the Children, like many other organizations, felt that the policy risk presented so much vulnerabilities to our young women and children around the world, and also the well-being of children regarding their health and their mothers. So when a mother dies for any reason, including unsafe abortion, a child is left alone or left behind, and the chances of them surviving is very limited. And this has caused us to be more upfront in terms of our child rights advocacy. And in 2019, as the Save the Children, we did do a public statement that states that the Mexico City policy infringes on the rights of girls and women in terms as their fundamental rights and puts their health and their lives at risk. So basically, in our reaction, we're saying that we needed to be out more and also make sure that our work is recognized, and we need to think more and see how this new rescindment or the rescinding of this policy, what does it mean to us? Or what should we do differently in order for us to really focus on the rights of women and girls going forward, especially in terms of sexual and reproductive health and rights? So the first thing that we need to do, like in terms of making sure that we revitalize ourselves, is to assess the gaps and the implications of this Mexico City policy that it has had on SRH for women and girls. I heard Ms. Masiwa talking about how they've done an assessment for Zimbabwe, but I'm thinking that we need to really do like a proper assessment of what it has done, especially at country level, at regional level. Tian spoke about funding that was lost and how many organizations had to change their funding streams and basically realign their programs in a way that will make sure that they continue surviving. But what are the implications that this Mexico City brought to us during especially the Trump administration? How can we address these issues and look at the different aspects of a young girl or a young woman that has been affected with this Mexico City policy? We look at issues of teenage pregnancies. What the rates of teenage pregnancies probably increased, and also there were rates of unsafe abortion cases, which led to mostly maternal deaths and also amongst young women. What else do we need to do to revitalize ourselves? We need to do youth-centered programming. I can look at what SheDecides has done. You can see that they're very much youth-centered, but with a specific focus of young women. We need to really focus on youth-centered programming, develop comprehensive SRH and CSE initiatives that are led by not only our young adolescent young people, but they focus on meaningful participation, on how do young people basically design programs that focus on them, especially when we are talking about accessing youth-friendly, comprehensive SRH services. Those are the things that we need to look at in terms of us being able to revitalize. We've gone through a bad phase of where young people couldn't access their services because of the funding issues, because of Mexico City policy. But what do we need to do now that the opportunities are being presented back to us? We need to be more youth-centered and actually involve our young people. And also we need to advocate for CSE inclusion in the school curriculum. This has been a very sensitive topic in the past few years, and especially last year with countries like Namibia, Zambia, where we saw a bit of a challenge in terms of inclusion of CSE in most of our curriculums because of the sensitivity of it. But the reality is that adolescents and young people need to be sensitized on CSE. They need to be sensitized so that they understand their sexual and reproductive health and rights. They make informed decisions about their sexual and reproductive health and rights. This will actually lead to us being able to see a change in behavior in young people, and also them being able to have age-appropriate and relevant information for their SRH decisions, so that we are able to see a decline in some of these issues that we think that are causing a lot of young people to then resort to issues of unsafe abortions or leading to issues of teenage pregnancy. So if we sensitize our young people and make sure that they have the information, we'll be able to make sure that we will reduce these kind of cases. The Mexico City policy was rescinded, but this doesn't mean that the funding will come immediately due to, you know, that there will be administrative processes that will be happening. It's just recent, and it doesn't mean that all of a sudden the US government is just going to give us funding. But you know, mostly they had programs that were running previously. Some of them ran up to 5 years and some are still running, but it doesn't mean that the funding streams are all going to be open and we have all these fundings that are coming through. And we have challenges, for example, like what Tian mentioned with the UK government. What do we need to do as civil society, as governments? We need to look at other funding streams, especially within our governments. We need to sensitize our governments to understand the importance of comprehensive sexuality education and SRH for our young people and young girls, that they so much invest into it. and make sure that our young people have all the information and all the resources that they need to get comprehensive sexuality education and also comprehensive SRH, and being held accountable for them to understand the importance of this comprehensive SRH. Rebuilding partnerships. Somebody spoke earlier about the organizations that were funded by the US government, the so-called non-compliant organizations. During the Mexico City policy, they were not. They decided, okay, we're going to remove ourselves from this funding from the US government, which created a lot of gaps. And I could hear from Ms. Masiwa how there was a less reach because the funding was lost and so many young people were affected and all that. But what do we do so that in the future, when something like this happens in the next 4 to 8 years, when there is a new president who comes in, who thinks that the Mexico City policy comes back, what do? We need to rethink our strategies. We need to look at sustainable partnerships, strategize for the future, look at like strategies that will make us less dependent, especially in terms of funding. What can we do? How can we re-strategize? Even within our strategies, we need to be clear and make sure that we are planning and preparing ourselves for the future in case this ever comes back to us again. This then links to issues of country level and regional level working groups that focus on comprehensive sexuality education and SRHR. We need to look at how they are not just functioning in terms of funding base, but something that is already existing. The strategies that we implement in these forums should be strong enough and sustainable enough for them to continue functioning. Because when you look previously, when we had the Mexico City policies, you see that the non-compliant partners were excluded on such platforms and discussions because most of the funding was probably coming from the US government with terms and conditions of what needed to be discussed. I remember when we had to participate in different meetings and whatever was happening in terms of SRH, we couldn't say certain terms or talk about abortion or family planning or whatever it is. Because of the funding that was being sponsored in that meeting, it made it impossible for us to even speak to the rights of young people accessing sexual and reproductive health and rights. So these are some of the things that we need to look at ourselves to try and revitalize ourselves and act differently in order for us to be able to support young women, and also seeing that we have this new dawn that is just clogged into us. How then do we make sure that we maintain this without having to go through another phase of the Mexico City policy if it ever happens in the next 4 to 8 years? Thank you.
Thank you very much, Tafazwa, for your presentation and just some of the issues that you're bringing to the fore. For example, the importance of having the youth voice to ensure that we have young people's voices also being heard, because their experiences will also inform how we move forward as we address, the effects of the global gag rule, like what Tian mentioned, the effects and the legacy of the global gag rule. And what you're talking about as well is that they haven't just gone immediately because it was rescinded earlier in January this year. We are still, reeling from the effects. We're still feeling the damage that was done. And now with the new issue that confronts us, with the UK government or with the UK aid cutting funding as well, we are now faced by more serious issues. So how do how you are bringing to the fore how we should look at bringing the voices of young people to the fore to ensure that as we mobilize and we re-strategize, we are ensuring that we are putting in place measures to also safeguard the health and the well-being of young people, and particularly looking at comprehensive sexuality education and how funding is decreasing, as well as the political will, decreasing as well from our respective leaders, particularly when it comes to issues of comprehensive sexuality education, how it remains a very sensitive subject, with a number of leaders not putting their full weight behind supporting comprehensive sexuality education. And also, it's very important that you brought to the fore the issue of sustainability, Now, we need to think about sustainability, particularly when we're looking at our leaders, our governments, when we're talking about domestic financing and funding for important issues, including comprehensive sexuality education, as well as other sexual and reproductive health and rights related issues, as we continue to face funding cuts, as we continue to face organized opposition to sexual and reproductive health and rights, as well as just the issue of inclusion, bringing everyone to the fore, all young people in their diversity to also be recognized as we revitalize the movement. Back to you, Mandisa. Thank you.
Thank you very much, Charmaine. Thank you for that very insightful presentation, Tafazo, when you spoke to us, reversing the legacy of the global gag rule and making sure that even as we're coming back to the table, different partners are coming back, as you, in your words, the so-called non-compliant partners who were actually refused to sign the Mexico City policy, as we are coming back to the table now to work within the new disposition. It's important to make sure that we support each other as civil society organizations in order to strengthen the movement, in order to make sure that even though we know that in terms of the political situation in the United States, the trend has been that the gag rule comes during one term and goes back and is rescinded during another administration. There was a call yesterday from Change, I'm going to repeat this again, who were actually saying they please follow Change on their socials. They actually have a letter and they're asking people to sign to say we are calling for the complete revoking of the Helms Amendment to make sure that it's permanently removed, so that we don't constantly live under the threat that we might be safe now, but in the next 4-8 years, anything can happen to us, because it also doesn't create sustainability in terms of all the work that we're doing. And it also continues to put a cloud over all the work that we're doing, knowing that even as we try to serve communities, even as we try to make sure that we conduct advocacy during this term, we have a term that's coming very quickly where we will no longer be allowed to do all that good work. So I'm also echoing the words that were shared yesterday by Sarah to say, let's be part of the movement, let's be part of signing the letter that says we need to make sure that it's permanently removed, so that even if a new administration, when a new administration comes into power, we do not find ourselves in a situation where we go back into the gag rule. And a lot of our speakers yesterday spoke to the seesaw and yo-yo effect of the gag rule and the US administration. We need to make sure that we remove ourselves from that oppression that continues to be over our cloud, over our heads. We've gotten to the interesting part of our webinar where we are taking questions and comments. We're inviting people who are participating or participants to either write in the chat box or write on social media if you're following us there, to make sure that you ask your questions and you are able to share your comments as well on the proceedings of the day. On our chat box, you'll see that if you look there, there's the link to for signing the letter from global groups urging congressional leadership to take action to permanently end the global gag rule. Please, it's done by Change and Amnesty International. There's also a website. Please go and look into it and make sure that you sign. It's going to make it incredibly easy to contact senators and representatives to ask them to co-sponsor the Global Hair Act. So we're asking everyone who's part of this webinar and everyone who's like-minded and cares about the movement and wants to be part of the movement to participate in this as well. They also did say that there are also very helpful resources and publications on the sites if you follow them. So please do take advantage of that. We're going to move right along to our questions and answers. We already have a question from Malawi, which came through our Facebook. I think it's directed at Chimwemwe.
Yes.
Yes. The question is, how have you been working with women with disabilities when it comes to the area of safe abortion? The question is from Takuzwa Ndiro Muvingi.
Great, thank you. So unfortunately, I wasn't able to access the video that I wanted to show everybody earlier. But what we did in our 10 episode series was that we were able to be inclusive of all marginalized women and groups, so even including the LGBTQI community, we did include them. We also are in touch with Light, which is an organization that works with different women. And also, unfortunately, I didn't have the pictures of the march, but we make sure to be all inclusive. So even when we do have advocacy and activism events, we make sure that all women are represented. So even those women living with disabilities, including sex workers as well, as mentioned, the LGBTQI community too. So when we are advocating, we make sure that it is all inclusive, that everyone is represented. So through our networks like the Young Feminist Network, we also work with Pepeta Malawi and IYFP Malawi. Through these networks, we have been able to find a balance so that it's not just young women, but we're able to represent everybody. I don't know if I've answered the question, but yeah.
It's clear to me that you've made sure that in all your work, everyone is involved, including people with disabilities.
Yes.
I think that's what you're talking about in your videos and all your work. You make sure that everyone is a part of that discussion.
Yes.
Charmaine, can I move over to you for the next question?
Yes, Mandisa, thank you very much. So I'm just going through the questions and notice that some of the questions that we asked earlier by participants as well as from social media, we answered as our participants as our respective discussants were going through their presentation. So we'll open again for a round of questions. If there are any more questions, please send them through. But whilst we wait for the other questions, just to encourage also, participants as well as other participants joining us via social media, as we were discussing and talking about the actions that we can be part of to join the flagship SAfAIDS My Choice, Our Choice campaign, which is focusing on ending unsafe abortion in the Southern African region. And now in the era of the rescinding of the global gag rule, we have more space and more freedom, to talk about the key issues that adolescent girls and young women are facing in the region. And we even have more platforms, to strengthen partnerships, because previously organizations and partners that were not able to speak about issues of access to safe abortion are slowly coming back on board. So that means we have strengthened partnerships. We have the call for SADC governments, to address issues of access to safe abortion, particularly removing policy and legal restrictions around access to safe abortion. Actually now, the discussions and the partnerships are becoming stronger, and we've been able to re-engage with a number of partners, as well as re-engage with key players, including political leaders and policymakers, to ensure that we put the health and the well-being of adolescent girls and young women within the Sustainable Development Goals framework at the core of our responses as we address issues of maternal mortality and morbidity, through improving access to safe abortion. So I'm just going to invite all the discussants to turn on their videos as we go through the closing, because we are going to come back to each one of you just to share with us, the practical steps that we can take as we move along, and just reflecting on some of the key issues that we're talking about. And just recently, the issue that we are faced with now with the cuts with the UK government. What do we do? Like what Tian mentioned, we had a moment to breathe and to celebrate as the global gag rule was rescinded, but now we are faced with another issue. So how do we come together and ensure that we mobilize and we re-strategize and come together and amplify our advocacy to ensure that the gaps are not felt, to ensure that we prevent or mitigate against the devastating effects of funding cuts on sexual and reproductive health and rights, and just overall well-being of of the citizens of Africa, as well as other developing countries as well. So I think I'll start with Mrs. Masiwa. Just 3 minutes back to you, sharing with us insights on the practical actions or the practical way forward that we can take as we address the rescinding of the global gag rule, and also just what we are faced with now, because we still have funding cuts, we have shrinking advocacy space, we have decreasing political commitment. How do we address these issues? How do we move forward and ensure that we still are working towards attainment of the Sustainable Development Goals, as well as universal health coverage for all? Back to you, Mrs. Masiwa. Thank you.
Thank you, Charmaine. Yeah, that's a difficult question. It's a challenging question, but I think for us as activists, we need to keep on strengthening our movements at country level, at regional level, and at international level as well. We must start talking to each other across countries so that we also share and learn from each other. And also, I'm looking at this kind of work. It's sometimes tiring. I'm sure some of us will agree with me. Sometimes you feel you are just flogging a dead horse, but if you are together, if you encourage each other, you'll be able also to push your agenda. And I'm looking at the issue of sexual and reproductive health and rights. For example, at SADC level, they already have a plan of action. Why don't we demand accountability to our leaders who have signed so many agreements at different levels? With regards to the cutting of funds by DFID, I think we need also to put our position forward and say our minds to really demand and show. We should be able to show why we are pushing for more resources to be put around sexual and reproductive health and rights. So this is my thinking, and we need to continuously refine our strategies as we go forward. Thank you. Over.
Thank you very much, Mrs. Masiwa, for that very strong call to action, and especially, bringing to light the issue of cross-sharing and learning. There are a lot of interventions that are happening across the globe, on the African continent, in other parts of the world, and there's a lot to learn. And you've actually just answered a question that came through as you were speaking, and this is from Her Royal Highness Princess Mihanta Ramanatsoa from Madagascar. And her comment was, following this webinar is encouraging for us in Madagascar, where abortion is criminal. How do we move in a sustainable way to progress? And like you have rightfully mentioned, Mrs. Masiwa, the issue of lessons and being able to learn from other countries and the other interventions that are happening, as well as just calling our leaders, asking for accountability from our leaders. There are a lot of commitments, there are a lot of declarations that have been made. So how do we transform those commitments into action? How do we move from just the rhetoric of promising that we are going to do something and promising to change the law, for example, to decriminalize access to safe abortion, to decriminalize, sex work, when we're talking about inclusion, and we are not really following through with some of our actions that we have. And her last comment was, we do have a lot to learn from all of you. And I'll move straight now to Humberto to just share with us the practical actions that we can take as we go forward. Thank you.
Thank you so much. And thank you again to all of you for your very insightful contributions. I would say that building solidarity across movements and across sectors is key in this, and breaking down the silos of this work and engaging with progressive governments as well. I know Canada hasn't always had a strong history in this area, and just like the United States, we are affected by changes in political parties, but we do have a government now that is extremely supportive of women's rights and the feminist agenda. So I encourage all of you to reach out to your local Canadian High Commission or embassies and engage with Canada in this respect, because you'll find allyship and support there, both in terms of advocacy at the local and international level, and potentially in terms of funding to support your initiatives as well. And yes, so building solidarity, using an intersectional approach. I really appreciate Tian's interventions and the reminder that this impacts a great diverse cross-section of folks. Many who are disproportionately impacted by various forms of discrimination, violence, oppression, exclusion. But women are at the center of this of this inequality, of course, and so we must continue to speak out against gender inequality, continue to work towards promoting equality at the highest levels. And men have a role to play. So engage with male leaders on this issue, appeal to them, help them understand that this is an issue that they need to support. They need to work together with their colleagues, and building on the strengths of civil society to address this issue, and help them understand that a lot of decisions that are made around sexual reproductive health and rights are based on misconceptions and miseducation, right? That you know, when you increase access to reproductive health and rights services, that you're actually impacting on by decreasing the number of unplanned pregnancies, by actually decreasing the number of abortions, because people have greater access to reproductive tools and information and so forth, and decrease towards discrimination and violence against LGBTQI folks and sex worker folks and so forth. So intersectional solidarity is one step I would take, and then also advocate for a decolonizing approach to this work, and helping to strengthen local capacity and ownership of these issues, and deferring to local organizations and their leadership and their expertise on this, because they know best how to address this with these needs with local communities. Thank you very much.
Thank you very much, Humberto. Indeed, intersectional solidarity is what we need, and this will really respond to the issue of inclusion. So making sure that we have the different voices coming together, and making sure that we have everyone represented at the table, so that the solutions or the practical solutions that we are proposing are responsive to the realities of everyone, you know, our lived realities and experiences on the ground, as well as just lastly, the decolonizing approach. That is very, very necessary, especially if we're looking at responses that are inclusive, as well as just moving away from the narrative that is rooted in heteronormativity, to ensure that, you know, all of our responses are looking at the different needs of each and every citizen of the globe. Thank you very much. And I'll move straight to Chimeme, your parting words or the practical actions that we can take as we move forward. Thank you.
I think the most important thing, and thank you to SAfAIDS for actually showing this today, is collaboration. You know what I mean? Obviously, as we've talked about, funding has been reduced across the spectrum for these sexual reproductive health and rights programs. It's obvious that it's better for us to make impact together, as opposed to fighting for the same funds and not really making as much impact. So I think going forward, it would be really, really, really good for collaboration across the sphere, seeing how it can be an intersectional, as Humberto has said, and just coming together, whether if there is an opportunity to apply for funding together, or opportunity to do projects together so that we're not duplicating efforts and just making sure that we are on the same page and creating our own narrative. You know, I think the pandemic has shown that aid it's not going to be sustainable. You know, every government kind of now has to look out for its own people. But I think I also agree with Mrs. Macio where she says that, you know, as a collective, if we're able to make noise at a regional level and hold our countries accountable and say, you guys kind of signed off on something, I think that will just definitely really help this fight. And like I said, with this webinar series, I think we're also collectively bringing people together and we're able to see, oh, this one is doing this one is doing this. How can we connect and make sure that we make a larger impact and just change the future for the generations to come?
Thank you very much, Chimwemwe, for those very powerful words. The need for us to move away from working in silos and ensure that we're coming together. We are amplifying our voices as we do advocacy, as well as we have practical actions and responses on the ground. And I'll come back to you, Tian, just for you to share with us the practical steps that we can take currently as we respond to the issue. Thank you.
Thanks, Charmaine. You know, what I've been thinking about as this discussion has unfolded is perhaps the need for us to stop and reflect and remind ourselves of where we've come from. Many of us on this call come from a rich history of advocacy, of talking truth to power. And so I would love to see a day where Melanie Robinson in Harare knows that she cannot go to any town or city in that country without being confronted by SRHR activists, by human rights activists who constantly remind her that the decisions that her and her government have taken have materially stripped away and set us back in ways that she can never imagine. In our work that is highly focused on the racial and gendered implications of this pandemic, we have to keep on the pressure. We have to let them know that no place is safe. So whether it's Melanie Robinson, whether it's David Ashley in Madagascar, whether it's Nick Casey in South Africa, all of these country representatives in our countries must know that every single time they step out for an official engagement, they are going to be confronted by activists who are going to demand for accountability. And we are demanding accountability not because it's fun or not because we're bored and have nothing better to do. We are demanding accountability because we are reminded that for every single woman who dies giving life, that is the fuel that powers us. That is the outrage that we must carry with us. We need to go beyond strategy development, engagements, petitions, policy work. That is all valuable. But I strongly feel that we're increasingly losing our ability to be radical and to hold those in power to account. And I think that's really important. One other point I'd like to make is to really implore everyone on this call, and it's something that we carry with us every day, and it's a learning curve, and we have to keep on reminding ourselves as we work at the Alliance that every single meeting you attend, every platform you engage in, look around you. Do you see the faces of queer people? Do you see lesbians? Do you see trans folks? Do you see people who use drugs? Do you see sex workers? Are those voices at the table? Have we absorbed a mandate that we are not qualified to carry forth? What are we doing to sacrifice our spaces at the table to make room for those people that we say we represent and we speak on behalf of? So let's have a meaningful look at every single engagement. Let's hold those representatives of the United Kingdom in all of our countries to clear account. And while we do that, let us not excuse the failings of our local and national governments to deliver a quality of life and dignity to all citizens that is worthy of living our full potential. And so that's equally important. I'm particularly encouraged by the comment by an anonymous attendee who said, I'm of the strong opinion that if we direct efforts to our government to prioritize domestic funding, absolutely. We've seen this in COVID. The reason why we don't have COVID-19 vaccine rollouts in many of the African countries is because our governments have dropped the ball. And so what are we doing whilst we hold the foreign representatives accountable for their role in holding us back globally? We also have to look internally. And that's very, very difficult and at times dangerous work. But we must continue to stand in solidarity, and we must continue the outrage of the death and the pain and the lack of development that has characterized this continent for too long. We cannot be silent anymore.
Thank you very much, Tian, for those very strong and powerful words. Really, indeed, there is a need for us to all stop and reflect internally, and as well as check our own privileges. Are we part of the solution, or are we contributing to the problem? And sometimes we consciously or unconsciously, contribute to some of the negative as well, not negative narratives, as well as just the perpetuation of the inclusion. We've become part of that. And now, as we were talking about the legacy of the global gag rule, some of us became part of the problem, supporting the global gag rule, and instead of just offering a solution. So indeed, there's a need for us to stop right now. And I think there's an opportunity with the webinar series as we continue to bring our voices together for us to look at how we can stop and reflect and think anew on what else we can do differently. How do we move forward differently to ensure that we are not just mentioning the need for inclusion, but we're actioning it. We're making sure that every conversation that we're having at the table, we have the various important voices really being represented. And I'll just go back to the comments that Tian referenced from anonymous attendee, and the comment reads, this is good advocacy work, but I'm of the strong option that if we direct such energetic efforts to our governments to prioritize domestic funding to health, including sexual and reproductive health and rights, we will not worry about the presence or the absence of the global gag rule. We should demand for adequate domestic funding for all public health interventions from our leaders in the global south, first and foremost, before we think and get worried about the global gag rule. Thank you very much, anonymous attendee, for your comment. And then Tafadzo, I'll just come to you. Practical actions, Tafadzo, practical steps that we can take moving forward. Thank you.
Thank you very much, Charmaine. I've been listening and reflecting on what the other panelists were talking about, on how we need to show ourselves, we need to react, we need to act as a coalition, but we can't do this without documented evidence. We need to show our governments, our funders, that this were the implications of the Mexico City policy. We've talked about how much losing specific funding led to so many unsafe abortions, young people dying, all these issues that happened. How do we document that evidence and put it in front of them so that it becomes a reality for them to see that this is something that needs to be really fixed? So when we have the documented evidence, it becomes easy for us to cry out, to speak out and say, the evidence is there. What are you doing? So that's the one thing we need to do, document our evidence and share it, so that in 8 to 4 years, when it comes back, we have strategies in place where we can actually say we've mitigated those challenges already, and we know what to do when it's back again. So that's the one thing that I would recommend. SAfAIDS or the coalition, whatever is created from this meeting, we need to document specific evidence related to the implications of the Mexico City policy, especially when it comes to unsafe abortion, teenage pregnancies, all these issues relating to family planning, anything that relates to our SRH, we need to document that. And I'll continue advocating for young people's voices. We need youth participation, youth-centered programming. Our young people need to be speaking, need to be present, need to be in part of these platforms where we talk, because they're most of the people that are being affected with these issues. It's not, it can be a marginalized young person, it can be a key population young person, but it's all young people. We need to make sure their voices are heard, and we need their opinions. We need them to participate in these platforms. So those are the things that I would recommend going forward. Thank you.
Thank you very much, Tafadzo, especially on us, or encouraging us to look at documentation of evidence so that as we are moving forward, we have evidence-based advocacy, we have evidence-based action plans and strategies, and that we are informed on our way forward, informed by the realities on the ground. We have the numbers, we have the stories, and then we are able to create solutions that present themselves as real solutions, or we have solutions that speak to the realities of young people. We have solutions that speak to the realities of women, of girls, of the LGBTI community. We have solutions that speak to the realities of sex workers, of everyone in urban areas and in rural areas, that speak to the actions that can be taken by different leaders that we have, be it traditional leaders, religious leaders, the leaders within the health and the justice sectors, as well as our policymakers. Mandisa, I'll hand over back to you. Thank you.
Thank you, Charmaine, and thank you to all our discussants for basically breaking down the movement. It's clear from the discussions today that the movement is multi-layered. While we are discussing and making sure we're mobilizing towards reaching Congress, we need to make sure that even at country level and at regional level, we're holding our national governments accountable, and we are holding SADC accountable. So the level of accountability and the different layers of what we need to do in order to move the agenda forward and to strengthen the movement has actually become clearer during this discussion. Everyone has a role to play. Everyone needs to make sure that they do what they need to do in country, which is at national level, at regional level as well, within making sure that SADC is held accountable, who are actually the heads of states, which comes back to what our countries have actually signed on to. How are we monitoring the signed conventions that our countries have actually? Are we actually doing shadow reporting? Are we contributing to the shadow reports? Or it's just become routine that we know that, okay, the report comes out, we do a shadow without actually doing due diligence to make sure that the critical issues are actually reflected in our shadow reports, and to make sure that when our countries present, whether at UN level or SADC level, the reports that are coming from us as civil society, the issues that are coming from the ground are actually reflected there. So thank you for making that clearer even today, to say we need to make sure that that happens. For me, another thing that came out very clearly, Charmaine, is the need for solidarity, and how solidarity sometimes will mean sacrifices. When Tian spoke about how we need to make sure that when we're in the room, we look around, are there queer people, are there sex workers, are there young women speaking there? Even as people who are purporting to speak for these groups, we need to make sure that they are on the table. And when he said that we need to make sure that if they are not on the table, we need to be willing to give up the seat to make sure that they're actually on the table. It spoke to actual individual sacrifices in order to move the movement forward. And I think our people who are participating today and everyone who's watching was also motivated to say, you know, in my own space, in every meeting where I am, I need to make sure that the people that need to be at the table are there. And if they're not, I need to encourage them. If they're speaking, I need to make sure that their voice is echoed. I need to support them. If there's a young woman at the table who is shy, I need to be able to say, you know, she raised her hand. I need to make sure that what she has to say is actually heard in order to move the agenda forward. And the need for us to continue to move in solidarity. Thank you also for the guidance on what we need to do in terms of addressing the issue of the reduction of UK funding, calling to action all players in all the countries to say, wherever there's a UK representative, they need to know in every meeting that they attend that people, civil society members, people that are part of the movement, will continue to ask the same question until this issue is resolved. And when we do that, we actually strengthen the movement, we energize the movement, and we strengthen the agenda going forward to make sure that any threat to access to sexual and reproductive health rights for women and girls and queer and LGBTI and sex workers and people living with disabilities is actually dealt with. And so that when people sit in their offices and their positions of privilege, they know that whatever decisions they make they will have to answer to someone. Somebody will ask them to say, was that the right decision? So going forward, they will know that accountability will be demanded of them. And that will also make sure that as decisions are made, even in Washington, even in UK, the consideration and due diligence will be done to make sure that the voice of a young girl in Malawi or in Eswatini in a village is also part of that deliberation. Thank you to all our discussants for being with us today. Thank you to our attendees who are part of this, our second webinar. We look forward to our third webinar next week on the 19th of May at the same time, 3 p.m. Central Africa time. Please continue to join us and follow the discussion. As we said yesterday, the webinar is to spark a dialogue, to spark the discussion. It's not, when the webinar ends, it's not the end of the discussion. It's not the end of the movement. It's just to say, these are the issues that we need to discuss and let us move them forward. So where we are, continue to follow us. This video of the recording of this session will be on the SAfAIDS Facebook page. If you are not able to participate or you'd like to share it with others, please do so to make sure that we bring as many people together to participate and be part of the movement. From myself, Mandisa Zwane Machakata, thank you very much for being part of our meeting today. I'd like to also recognize individually our speakers for today and the different organizations that they came from, because we know that the movement is not just from one organization, but because we are all coming together and moving together, we actually will be stronger. So I'd like to recognize my Ms. Musiwa, who's the Executive Director for the Women's Action Group in Zimbabwe. Thank you very much for being part of this discussion. Thank you to Humberto Carollo from White Ribbon Canada and the Global Chair of MenEngage. Thank you for being a part of this discussion this afternoon. Thank you to the voice of young women and the face of young women today as well. Chimwemwe Mlombwa from Kwatundi Kwanu and SheDecides Malawi. Thank you for being part of this discussion as well. And Tian Johnson, our passionate speaker from African Alliance and founder, the words that you spoke today will really continue to echo in our hearts as we continue to move forward and we'll continue to drive the passion in our own hearts. When you said we need to speak to truth, to leadership, it really resonated in my spirit. Thank you to Tafadzwa Madondo as well from Save the Children under the SRH Knows No Border project. Thank you very much for being part of our discussion today. We really appreciate all the work that you are doing to move the agenda forward, and we continue as SAfAIDS to enjoy this partnership and to commit to continuing to move this agenda forward. Thank you. Over to you, Charmaine.
Thank you very much, Mandisa. And as you were speaking of solidarity, we invite our esteemed discussants as well as the participants, to join us and support the SAfAIDS flagship My Choice, Our Choice campaign, which is focusing on ending unsafe abortion in the SADC region. The campaign is calling on our policymakers, particularly to remove restrictive laws that govern access to safe abortion, but we are also calling and working with men and boys, Umberto, we're also calling and working with men and boys to ensure that they support women's agency and bodily autonomy and the choice whether or not to have children. And we are also working with adolescent girls and young women to ensure that they fully understand issues around their rights and are able to demand for their rights, as well as seek services and understand the law as it stands currently and the impact of the removal of the restrictions around access to safe abortion. Thank you very much for joining us. And like Mandisa mentioned, this is only part 2 of the 3-part webinar series. And next week on the 19th of May, we have the last part of the last webinar series where we continue this conversation. And as Mandisa said, and I'll also echo all of the esteemed discussants that we had today, we need to move forward with action. It's not just enough to speak about it, but how do we mobilize and become stronger on the ground and make sure that we are moving forward and actualizing some of the commitments and the words and the discussions that we had today. We are actualizing them and we have them manifesting into actions. Thank you very much, everyone, for joining us today. Join us again next week on the 19th of May. Good day.
Thanks, everyone.
Thank you,
Thank you all. Take care.
Thank
Thanks
you.
for your great work.
Bye-bye.
Thank you.
Thank you.
Bye-bye.